So the next technique that I'm going to offer is sensation expansion. So this is also part of ACT, it's also part of somatic experiencing. And pretty much what we want to do is we want to get ourselves into the practice of sort of noticing when we have sensations in our body and not trying to clench around them. Because a lot of times we're trying to control it or constrict around it because it's overwhelming and it's a lot. So what we're doing is we're noticing our thoughts. We're not letting our thoughts be in charge. So we're going to notice when we have thoughts and we're going to offer them. We're just going to say, okay, go ahead. We're noticing you. You can be here, but I'm going to come back into my body. We might notice our emotions, the emotional acceptance, so just kind of letting it be there. And then the next step is we want to really notice any sensations that we have in our body. It might be a tightness in our gut. It might be kind of a fluttery feeling in our chest. It might be a lump in our throat. It might be a headache or tension behind our eyes. And the temptation is, I want it to go away. So this is new. This is sort of counterintuitive. It's a different practice. But what we're offering is, what if I just let that sensation expand? What if I let it do whatever it needs to do? It might need to get really, really big. It might need to move. It might need to get really, really intense. There might be a weird, sharp pain in your neck. So it's not stretching it out and trying to make it go away. It's saying, okay, what if I just let that get more intense? Even if it feels scary. If it feels scary, then we just allow that emotion to be there. Maybe notice any thoughts that are like, well, it's scary because of da-da-da. We're going to ask the thoughts to step back. We're going to notice the emotion with compassion and love, and then we're going to really just let our sensations do whatever they need to do. This is a practice that, honestly, it's what we do when we're little anyway. It's mostly we're just kind of taught to not feel these sensations, to constrict around them. Other people are afraid of them or freak out about them, so we kind of freak out about them or try to control them or constrict them. So what we're doing is we're kind of getting back to this knowledge that we had before, that sensations just need to happen and it's okay. And if there's a big feeling of fear or even like a trauma trigger, just very, very gently, just offering, just some compassion of like, oh yeah, that's a big one. And if it's a lot, if it feels like too much, that's definitely when I would recommend seeking a therapist and doing it in a therapist's office or in session with them, so that you have that nice container. You have someone else there while you're kind of working through allowing space for these sensations. But if they're kind of smaller sensations or they're not as triggering, getting into the habit of just sort of allowing them to be there and allowing them to expand and seeing what happens next can make a big difference. I'd also recommend doing this exercise with your feet on the ground, just because sometimes having our feet touching the ground just allows our energy to just move a little bit better. And so allowing that expansion with our feet on the ground can just be extra helpful. So I'd highly recommend trying that.